Hello everybody, I'm delighted to welcome you to this special product live session. Today we're coming live to you from Wound Care Today in Milton Keynes. I'm delighted that I've got with me here today Jane Mays from Essity, and she's here to talk to us about their brand new education offering Path. So before we have a discussion, welcome Jane, it's so great
Alison.
to see you here today. So over to you, tell us all about Path.
Thank you so much, Alison. So as a nurse myself, I really do know the value of quality education, like you, Alison. But before we get into Path, I'd like to share some views of my colleagues out there.
Good clinical practice doesn't exist without great educational structures to embed the right care strategies and pathways for our patient care. To achieve good patient outcomes, we have to educate our workforce in health and care services. It motivates and empowers them, and then in turn they can deliver that good patient care.
It's really important that we do education simply because the patient that we're caring for gets the best possible care. We know that the people that we are working with are given the opportunity the best that they can be, but also that when we look back at our care, we can be assured that actually over time that the care that we're providing is improving year on year.
The value of education is to widen our knowledge base, to underpin our practice with up-to-date information in order for us to provide gold standard quality of care to each individual. Without education, we wouldn't be able to achieve this.
Education for me improves my competency and my confidence in my work. It helps me to stay up to date with the best practice, which is evidence-based, and ultimately for my patients, it means they get a better standard of care with better patient outcomes and also a much more efficient service and an efficient treatment plan.
What education means to me is that it gives me the tools to do my job. It identifies areas where I have a good skill, and it also identifies things that I don't know. It embeds the research, it helps me with getting the policies into practice.
So I think education opens doors. It gives you more opportunities and gets you into places and to meet people that you might not have had the chance to meet before. And I think it really can inspire people, and it can really lead to promote positive changes in practice and improve standards.
Education really is important to us all. COVID has really changed how we deliver care to our patients and how we access education. And at Essity, we really have thought about this and really explored different ways that we can deliver education to you. We've built some new styles of learning, which we'll look at shortly. But we've also really focused on styles that we already have and add content to that so that you can learn wherever you want, whenever you can access education. We learn it all the time. We also needed to make our educational offering really simple to understand. So, Path, what is it? It's a journey. We're all on a journey. We all want to learn. I know my career, and Ali, I'm sure, has taken us on lots of different paths, but on the way we need to learn and develop our clinical skills. So Path really helps us do that. It's simple. Everything needs to be simple. We're so busy. So it's pick your therapy area. And as I'm sure you're aware, at Essity we have many therapy areas. Wound management, lymphedema care, lower limb management, orthopaedics, and even at the bottom there, animal health care, which some of you may not or may understand. It's then choose the topics within the therapy areas. So wound management, we can then look at what topics we've got. So looking at surgical site infection, wound assessment, infection management, it's all within our Path offering. And then after choosing your topic, it's about the learning styles that suits you. The current climate has meant that we have to learn wherever we can, and as nurses we're really hungry for education. One of our new styles of learning is bite-sized learning. we cannot undervalue the face-to-face interaction that we have when we're learning. So this is a style that still allows us to connect as clinicians, hold conversations and learn together. However, we know time is so valuable. So these bite-sized learnings are very small opportunities, so valuable, could take up to 30 minutes, an hour, where we can connect together over a lunchtime session or any time to suit your clinical team. So PATH really is a journey, and I'd like to show you a little video to help you understand a little bit more.
It's so interesting, Jane, isn't it? I love the PATH concept, and it just caters for everybody, really, you know, in
Absolutely.
so many different styles. And Essity has, you know, a lot of different, you know, care areas that you cover. So how have you incorporated that into PATH?
Absolutely. We've put the patient, Ali, at the centre, and it's all the holistic approach, isn't it? So we feel at Essity now, our offering really helps you in all those areas, taking that patient on a journey with us, really. So looking at them from all angles. So continence care being one of them, orthopaedics, and obviously wound management, which is where we're at Wound Care Today looking at. So it does take a holistic perspective on our patients' care, which is really important.
Yeah, people, you know, as a clinician myself, you know, we are clinicians, aren't we?
Definitely.
TVNs, and you know, people in practice will really appreciate that. You've got, you know, it's just covering so many areas of continence care. You know, people
Definitely.
You know, we need to have so much more on that. So that's absolutely fantastic. And that traditional educational style that we've always been used to, you know, face to face in a classroom, you know, it's sort of changing, isn't it? And I mean, certainly in the past 18 months, what's the feedback from clinicians out there to you as a company regarding that?
I think, you know, we've been really proactive. We've known, haven't we, Ali, for a while, that actually that face-to-face time, we'd love to come and offer sort of a full afternoon, but we both know how, you know, the capacity out there isn't there. So we really have had to adapt to that. You know, it's been great. We've had sort of people joining all sorts of sessions and, you know, in the bath watching webcasts. I'd like to say they've been watching you in the bath, Ali, but hey.
Maybe so.
Yeah. So our webcast learning, our e-learning, you can access on your phone. We've also had people joining in cars from community nursing with laptops balanced on sort of like their steering wheel. So for me, we've been able to deliver education, but it was changing before the pandemic in the way that we access education, and we've really responded to that. So we've had some great feedback. We've had some great feedback here at Wound Care Today. So yeah, it's a great time for education.
Yeah, and because, you know, time, like say, even before the pandemic,
absolutely,
you know, time and resources is just got less and less. So people
Absolutely.
being released from clinical practice is so difficult. And I know I used to deliver a 4-day course which ran over like a month period. And the beauty of this is people can, you know, dip in and out and access and different learning styles and everything like that. It's not just once a year, every 3 years, or, you know, anything like that. It's a continuous ongoing learning.
Definitely.
So that's amazing.
Definitely.
So, you know, aligning PATH education to, you know, like national guidance such as, you know, the National Wound Care Strategy, for example, does it do that? How does it incorporate that?
Absolutely. I mean, it's great work, isn't it, from the National Wound Care Strategy programme. Fantastic. So we really want to complement that great work and bring other elements, other styles of learning and other topics to support the clinicians in that area. Yeah. So one that springs to my mind, and we both had this conversation off air, haven't we, about the immediate and necessary care concept. great piece of work, a great piece of thinking for us to really put care into place very early to prevent deterioration of these lower leg wounds. I put my hat on as a nurse, and we're both nurses. That's quite sort of like a little bit of nerves for us, isn't it, out there in clinical practice? So one of our bite-sized modules really does allow us to help you as clinicians out there to really think, how can we take on board this new recommendation with confidence and competency.
Yeah, and it's important for us to take the national strategy work, isn't it, and their frameworks. That's why they've done it. They've produced it, so we can then embed it into practice. It's up to us to spread the message, really.
Absolutely right, and use our styles of learning to consolidate the great work that they're doing. So
the strategy also has, and it's quite new, a core capability framework which runs across all levels of healthcare professionals in wound care for their knowledge and education building. Does PATH complement that as well?
Absolutely. Do you know, it is about us looking at our workforce. We know from the guest report, don't we, Ali, that the workforce has changed. The healthcare assistants, such a valuable element to our working force out there, and we need to educate everybody. Education needs to span across all areas of the workforce, and PATH really does do that. I know we've talked a lot about the back to basic education. We can't get enough back to basics. It underpins clinical care and patient outcomes. So the round wound management especially.
Yeah, and you mentioned with the guest report, and it does say, number of tissue viability specialist visits reduced, increase in district nursing visits, but there isn't an increase in the staff, is there? So, we have to keep reiterating the messages. So PATH's got lots of learning styles, and one of the elements is e-learning modules, and and they're so robust and fantastic. So the lower limb element of that, what does that include?
Absolutely. So lower limb care is something that we're both really passionate about, isn't it, Ellie? And we've both done that, where we've delivered our NHS educational package that can be over, say, a 2-day period. So what was important for us at Essity was to help and complement that great work that we do in the NHS, but time is so precious to cover all the concepts. So through our e-learning modules, we really feel that will help consolidate the great work that you're doing within an organisation. And I know we've both shared it. If we'd have had those e-learnings when we were delivering our in-house training for lower limb, it would have really helped our educational content, wouldn't it, and embedding the knowledge.
It would, and what I like about it is because, like we just said, core capabilities from all different ranges, and there's many more people involved in lower limb care now, so we're expanding that to them. But also we've got that, it's really robust on the vascular assessment. It goes into great detail about there, and you go into that specialist element of lymphedema.
Definitely.
So it really is robust. I guess that's what
Absolutely, and it's great, isn't it? Our population are changing. We're living longer, multiple comorbidities, lower limb edema. Such a challenge for us, and we've both been there, haven't we? Trying to manage those leaky legs and lymphoria, and trying to assess those patients in the home. So any element of education that you can revisit again in your own time, the flexible approach to it really does have an impact on positive patient outcomes.
Yes, it's a one-stop shop, isn't it?
It is a one-stop shop. Yeah,
I wish it had been there when I was training.
Definitely is, and it covers so many aspects, like you say, the continence care element in there as well.
And
so
for care home staff as well, student nurses, it's all accessible, isn't it? Yeah.
Definitely at Wound Care today, we've had some great interaction with all sorts of different healthcare professionals and students, and they're starting out on their path. So this is definitely something that they'll be able to access, and we're building all the time. It's the house is built, and we were just chatting offline about the different topics that we can get into our path offering. So it definitely isn't all built yet. There's lots of opportunities.
The sky is the limit. I'm excited to see what's coming.
Definitely.
So how do clinicians get their hands on PATH? How are they going to, what shall they do? How are they going to get it into their practice areas?
Absolutely. So we're a big team at Essity. We've got lots of people waiting out there to answer your emails. So I think on the screen now you should see our email that we'd like you to contact to take come on a journey with us, really, and access our PATH education.
Yeah, it's great. So honestly, please do go and have a look at it, because it is fantastic. Jane, thank you so much. It's always a pleasure to chat with you. Yeah. Thank you for giving your time to us here today. And I'm sure we'll speak to you very soon.
Absolutely. Thank you for having me.
It's a pleasure. So thank you all very much for watching. We hope you found this session useful, and we hope you will join us again very soon for more Facebook Live sessions.